Hi, my name's Shelley. I'll be your nurse practitioner today. What's bringing you in today?
I'm having trouble breathing.
You've had trouble breathing. How long has that trouble breathing started?
About 2 days.
About 2 days. What are your symptoms?
Coughing and congestion.
Coughing and congestion. What are you doing to make it better?
I take an inhaler.
You take an inhaler? Okay. And what makes it worse?
It gets worse at night.
Get worse at night. Do you have any sick contacts at home?
No.
Okay. Are you able to sleep at night?
Yes.
Okay. And you're able to get up to go to work?
Yes.
Okay. And how long have you been taking your inhaler? How often?
At night.
Okay. Okay. Does that help? It does. I'm going to just ask a couple of questions on your past medical history. Have you had any hospitalizations or surgery? Okay.
No.
Do you have any chronic conditions?
Asthma.
Okay. And when were you diagnosed with asthma?
When I was 12.
When you were 12. What triggers your asthma?
The weather and physical activity.
Okay. It's been pretty cold, hasn't it? Okay. What other medications are you taking other than the inhaler?
None.
Okay. And it's an albuterol inhaler? Okay. Do you have any allergies to drugs, medications, or seasonal?
Seasonal allergies.
Okay. And cats? Okay. Do you smoke?
I do.
You do? How much do you smoke?
About 2 cigarettes a day at night after work.
After work? Okay. And then, have you been out of the country in the last month or so? No. Okay. Does anyone in your family have any pulmonary issues?
Oh, my sister and my mother both have asthma.
They both have asthma? Okay. Do you have any shortness of breath?
Yeah, a little.
A little? Does it progress at certain times of the day?
At night.
So it seems to be at night that's the worst. Okay. Do you have any pain when you breathe?
No.
Okay. What about coughing? You said you had some coughing. Do you have, is it spontaneous? Is it triggered by something?
I cough.
Do you have a frequent cough?
Relative.
Okay. And does it progress at night?
Yes.
Okay. Do you have any productive cough? For instance, do you have any spit or congestion? You said you were congested in your throat. Okay. And does that come up when you're coughing? Okay. What color? Have you looked at what it is when it comes up?
It's yellow.
It's yellow. Is it thin, thick?
It's more on the thick side.
It's on the thick side. Okay. But are you able to cough it out? Okay. Let's see here. What about blood? Have you noticed any blood in the sputum?
No.
Okay. And then, how long have you been coughing up the sputum?
About 2 days.
About 2 days. Okay. All right. So I'd like to perform a physical exam on you, if that's okay. Okay. So what I'm going to do is I'm going to look at your trunk. I'm going to assess your lungs. I'd like to assess your heart. I'd like to look at your skin, and then take a look at your abdomen as well.
Okay.
Okay. Let's see here. So what I'd like to do is inspect your thorax and chest. I'm looking at for anything that is abnormal, any deformities. I'm looking at your posture. Let's see here. Everything's symmetrical. I don't see any work of breathing. I also want to look at the front as well as the back. And if there's anything abnormal there. Everything is symmetrical as well. We're also going to look at the AP transverse diameter. So what I'm looking here is the distance between, this should be about half of what the transverse side or posterior side of her back. And this here is correct. So she has a normal AP transverse diameter. Next I want to do is do some palpation. I'm going to palpate your intercostals to your front as well as your back. So I'm just going to feel for any crepitus. I don't feel any crepitus here. Let's do your back as well. And everything is normal there, it's symmetrical. Next, I'd like to look at the expansion. Actually, I'm going to go back around. I'm sorry. I can just get you to face here. I'm going to look at your thoracic expansion. So what I'd like you to do is just take some couple of breaths in and out. I'm just looking at my thumbs, making sure that they go in and out, which are normal. And then I'd like to look at the costal angle of your front. So I'm going to just place my hands on your front as well. Take a couple of breaths. Everything is normal there. Now I'd like to do some palpation on your back. So I'm going to give you some simple words to say. 99 is what I'd like you to say. Every time I put my palm on your back, I just want you to say 99.
99.
Great.
99.
Great.
99.
Great. And that's normal. What I'd like to do is percuss your lung sounds before I listen. So I'm just going to go from the front to the back. Great. We're going to redo it. Right. Great. Go to the back. Thank you. Next, I'm going to actually take a listen. I'd like to listen to your front as well as your back, just to make sure I'm listening for any kind of adventitious breath sounds. I'm looking for just normal, clear, but you do have asthma, so let's just take a listen. I'm going to get you just to breathe normally. Take some nice breaths. Breathe in. Great. Great. Take a look at your back. Breath in. I hear some wheezing up in your upper bilateral lobes, and then you're slightly diminished in the bases bilaterally. Next, what I'd like to do is I want to get an idea of, I'm going to do a brachophony, so I'd like to then listen to you while you say the word 99. Go ahead.
99. 99. 99. 99. 99. 99.
Great. Your voice should be muffled, and in the event if it was clear, at that time I would be looking for signs of lung consolidation. I want to listen one more time on your lateral side, so if you could raise your arms up in the air. Go ahead, breathe in. Breathe in. Great. Okay. So let's start with doing looking at your heart. So what I'm going to do is I'm going to inspect your chest. So I'm looking at your apical pulse. So what I'd like you to do is if you could lay down here. All right. So I'm looking at your apical pulse. And what I'd like to do is if I can see, there we go. Great. I'm just looking at, and then I'm going to palpate your precordium. So I'm just see if I can feel. going to then listen with my diaphragm first. Okay, now with my bell. Okay, great. What I'd like you to do is sit upright if you can. All right, I'm going to listen to you again with my diaphragm. Okay, great. Now with my bell. Okay. And if you can lay down on your side, your arm raised. Great. I'm going to listen to you again with my diaphragm. Now with my bell. Okay, great. So S1 is located at the apex. It's nice and loud. The S2 is located in the base. That's louder than the S1, as well as it's higher pitched. So next I'm going to compare the apical pulse as well to the radial pulse. So I'm going to listen to my apical pulse while I palpate and they are in sync. I do not hear any presence of a murmur. I don't hear a gallop. I'm not hearing any clicks. It is a nice regular rhythm. And next I'm going to do is I'm going to auscultate her carotid artery. So first I'm going to listen, then I'm going to palpate. Now I'm going to palpate. Great. Listen. Palpate. No sign of any breweries. Next I'm going to assess the JVD. So I'm going to have you sit down, if you can, lie back on your back. I'm going to press on your stomach. And then I'm going to look at if there's any jugular vein distension. I don't see any at all. Okay. Next, I'm going to, since she's lying down, I'm going to take a look at her peripheral vascular assessment. I'm looking at her upper extremities. I'm looking for skin coloring, pallor, any presence of edema, any ulcers, looking at cap refill, which are right at 3 seconds. Let's see, we're looking at hair distribution as well. Everything looks fine. Now I'm going to look at the lower extremities. I'm also looking at bilateral and looking to see if there's any presence of edema, any ulcers. We're looking at heels as well. I don't see any. Color, temperature, which is all normal. and cap refill, which is all normal. Now I'm going to palpate for pulses. We're going to start brachial pulse here. Which is normal. Radial pulse. I'm going to do femoral pulse. I'm going to work down here. I'm going to do the, the posterior tibia pulse. And her pedal pulses. And then next is the popliteal pulse. I'm going to get you to just roll over if you can, just on your belly. And then I'm going to touch your lower extremities here. And I'm looking for the popliteal pulse. Great. Our last test is the ankle brachial index. So at this time, I'm going to get my cuff. If I can get you to sit up for me. Thank you. I'm sorry. Okay. This time I'm going to make note of the systolic. And then I'm going to work and check out her brachial systolic. And then what we do at that time is we make sure that we divide it, and we want to make sure that it equals 1, and that means that it's normal. Right? We are at 110. I'm going to get you to go ahead and lie back down for me if you can. We're going to do the same side. I do not have a Doppler. If I had a Doppler, I'd probably get more of an accurate result, so I am just going to pretend that I have one. So what I would do is I would use my Doppler, identify her pulse in her foot, her pedal pulse. And at that time I would mark it. I'd stick my Doppler on there, and then I would blow up my cuff. And then I would note it, the systolic, when it starts, and that's the number that I would use, and divide it with my brachial pulse. And again, if it was at 1, that means it would be normal. So last assessment I want to do is I want to do the abdominal and kidney exam. So this time, I'm going to have the patient just lift up her shirt a little. What I'm doing is I'm looking at her abdomen, I'm inspecting it and making sure that there is symmetrical. I'm also making sure that there's no distension. I'm making note of any venous patterns as well as any stria or any kind of scarring. We want to make sure that I don't see any bulges or masses. I'm always going to listen to her stomach first before I palpate or percuss. So I'm going to listen for all 4 quadrants. I'm going to listen for vowel sounds. Vowel sounds are present. Next, I'm going to also tape for vascular sounds. So I'm looking at the aorta sounds. I'm going to look at renal arteries as well as the iliac arteries. So here's my aortic. I should not hear any vascular sounds. Next, I'm looking for any friction rubs. I'm assessing the liver for any friction rubs and the spleen for any friction rubs. This time I'm going to cuss the abdomen. So I'm just going to start here and kind of work in a snake-like fashion. Okay, great. Next, I want to kind of look at the span of the liver, and I'm going to use the percussion technique. So what I will do is I will percuss from down and work my way up. And then once I hear a dullness, I'm going to just mark the spot. Then I'm going to work from the lungs down. Once I hear some dullness. At that time, then I will measure. And typically, the liver span should be between 6 to 12 centimeters, which is accurate for a normal adult. Next, I'm going to lightly palpate her abdomen. I'd like her to tell me if there's any tenderness or pain. Any tenderness, pain? No. Then I'm going to do deep palpation. I am palpating her solid organs, so I'm palpating the liver, and then I'm palpating the spleen, as well as the bladder. Just let me know if you feel any tenderness. Any tenderness? No. Okay. Then I'm going to perform some abdominal exams and give you rationale and the reason why I'm performing them. First, I'm going to perform the Murphy sign. So at that time, I'm going to lay my hand down over her liver. If she feels any tenderness, pain, or grimacing, that's a positive Murphy sign, and that's indicative of inflamed gallbladder or liver. Hook, and then I'm going to do indirect pressure, and there is no tenderness. So it is not a positive Murphy sign, excuse me. Next test, I'm going to do the iliopsoas muscle test. At that time, I'm going to lift her left leg up. That's kind of like a indicative of appendicitis or an inflamed appendix, excuse me. So I'm going to lift her left. I want you to lift your left leg up. And then I'm going to give a little resistance. Do you have any pain? Okay, so that is a negative iliopsoas muscle test. Next, I'm going to perform the arbitrator muscle test. That is a test that kind of gives a heads up of whether or not the appendix has ruptured or if there is a abscess, a pelvic abscess inside the abdominal cavity. I'm going to lift your leg up. Any pain? No pain? Okay. Next, we're going to do the roving signs test. That is a test to kind of give another indication of whether or not there is appendicitis. And that time, I'm going to press lightly on the lower left quadrant, or the left lower quadrant. If I tap or press gently and release really fast, do you have any pain anywhere? Okay. So if it was positive for appendicitis, you would have pain in the right lower quadrant. Next, I'm going to do the Kerr sign. Do you have any pain here on this right upper quadrant of your abdomen? No pain? Do you have, on your left upper quadrant? Do you have any pain in your shoulder? Okay. So positive Kerr test, if she had pain in her left upper quadrant as well as pain in her shoulder, that would be indicative of ruptured spleen, or there could possibly be blood or other material that's free-flowing in her peritoneal cavity. Let's see here. Our next and last assessment, let me get this tape off you, excuse me. You could sit up. Is I'm going to assess her kidneys. This is going to be assessing CVA tenderness. So what I'd like to do is I'm going to do indirect percussion on her back, just to see if she has any tenderness on her kidneys. Go ahead and sit right here in the face. So you can just let me know if you feel any tenderness or pain. Any tenderness, pain? No. Okay. All right, that is the last of our exam. Thank you very much, Alana. So basically, I finished my physical exam for video 2. Thank you. Go ahead and have a seat. Sorry. This is Alana. She's a 26-year-old female. She presents with some asthma symptoms, and she states that she's been having trouble breathing for the past 3 days. The patient has had a history of asthma, as well as she uses an albuterol inhaler. But the last couple of days, she said too, she's not received any relief from her inhaler, and she's still having trouble breathing. She was diagnosed with asthma when she was a child. She's allergic to some cats, as well as she does say her asthma does flare up when there is a difference in weather, and especially when it's cold. She hasn't been hospitalized, or she's never had any surgeries as well. She has a family history of asthma. She said both her mother and sister have asthma. She said she smokes about 2 cigarettes a day after work. And she has been smoking. How long have you been smoking?
About 10 years.
About 10 years, excuse me. She is not showing any signs of respiratory distress. She's complaining of a frequent cough with some yellow, thick sputum. She's had the cough as well as trouble breathing that has increased at night for the past 2 days. Upon respiratory exam, she has some inspiratory wheeze to the bilateral upper lobes, as well as she's diminished in the bases bilaterally. She has a productive cough that has some thick yellow sputum. I don't see any work of breathing, no retractions, no nasal flaring, no pursed lips are noted, no respiratory distress. All other exam findings are normal. Thank you very much.